Hello, this is all about prescriptions part 2. My name's Karen Ford, Senior Lecturer and Prescribing Lead at De Montfort University. So the aims and objectives of this part of the lecture is to get you to think about different types of prescribing in hospitals. Was the previous part 1 we looked at more focused on community prescribing. Thinking about prescriptions for non-NHS and allied health professionals. And errors in prescription writing. So we've looked around errors in terms of assessment and not getting the information right, not listening to patients. Now we're looking at actually when you get down to writing the actual prescription. And you've probably already had a go after the last lecture at writing some prescriptions and having them checked over. And you may have already spotted some of these potential areas as well. So first of all, hospital-based nurses. I usually can use one of 3 ways of prescribing, so it's different to the community prescriber who will use an FP10, either handwritten or computer generated. So first of all, there's a ward order, and that's used for inpatients and discharge supplies only, so that's your drug chart. And prescription charge in the NHS isn't levied on outpatients, sorry, on inpatients, and charges going for those drugs they take home. The second method is internal hospital prescription form. This is used for outpatients, but only where the hospital pharmacy will dispense a prescription. Prescription charge might be payable unless the patient's exempt from prescription charges, and obviously got to prove that as well. So these forms, these internal hospital prescription forms, often resemble an FP10 because their function is very similar, really. And the third one is an FP10HP prescription form. And this is used where the prescription is going to be dispensed by community pharmacists. So it may be written in an outpatient's clinic, for example, but not dispensed in the hospital, but to go back out to community pharmacists. And this may be one area where a hospital stamp with a nurse's individual details may be used on this type of prescription. For those not working in the NHS, so those working in the independent spectrum, for those working in the non-NHS jobs, such as the independent sector, for example, aesthetic nurses are a large group, about 3,500 in the UK at the moment, or allied health professionals in terms of how they prescribe. So a non-NHS prescriber can't use an FP10 unless they're working in an organisation which has an agreement with the local NHS provider, like, for example, a PCT. So they will be writing private prescription in that case. Allied health professionals, they have to have their qualification recorded on the HPC register after they're qualified, and they usually will use the same prescriptions as the community or hospital nurses, depending on what they would normally use. So, well, with all the changes happening in primary care, if we had a magic sorting hat, we might be able to work out, what's going to happen in the future with the new system. And really, no one really knows until the system's up and running, whether it be foundation trusts, whether it be consortia, etc. We don't really know whether there'll be changes ahead. So obviously, that's something that needs to be considered if processes change dramatically as well. If a non-medical prescriber were to change their name, either by deed poll or to get married or divorced, change their name, they need to have their prescriptions changed, particularly if they choose to change their name for practice and their registration with a professional body changes, they'll need different prescriptions. And so it's something you need to consider in terms of, one, do you want to change your name for practice? Because you'll have to be without your prescriptions for a time while the old system, you have to get rid of your old prescriptions and the new system kicks in with the new prescriptions. If you're in a hospital, it's much easier because particularly if you haven't got a stamp, you're just writing a different name, which is now the one that's on the register for you, but it must be the same one. Employers normally keep a database, and prescribing leads also around the different trusts, community or hospital keep databases of prescribers, so they know who they've got, what types of professions these people are prescribing, whether independent or supplementary, etc. And they do monitor prescribing practice and get back prescriptions, pack data, etc., and find out the trends in prescribing, errors. They may call the individual prescriber in if there's particular issues they need to discuss. So it isn't something that's you write a prescription, it's gone forever. It is scrutinised, so just be aware of that as well.